So nursing care for sickle cell disease focuses on providing hydration and oxygenation, managing pain, monitoring for complications, and providing prevention teaching. So on the NCLEX, what's always our priority? Well, it's those ABCs. And remember, in a vaso-occlusive crisis, we have that sickling and clumping that causes a traffic jam in those blood vessels. And that leads to decreased circulation, that C from our ABCs, and decreased oxygenation. Therefore, our number one priority is treating what causes that vaso-occlusive crisis. And those triggers are that hypoxia and dehydration. And so we need to treat that by providing hydration and oxygenation. So we provide oral and IV fluids in order to treat that dehydration and get those red blood cells moving. We also maintain bed rest because bed rest is needed to decrease that oxygen demand because these clients can have hypoxia. Then we also administer oxygen as needed, and that helps treat that hypoxia as well as prevent any further sickling of those red blood cells. So we give hydroxyurea, which increases production of normal non-sickled hemoglobin, and we give blood transfusions to introduce more normal red blood cells into circulation, and these both do the job of increasing perfusion and decreasing clumping of those blood cells. So remember, sickling causes decreased oxygenation that leads to ischemia, which is super painful. So as nurses, we need to help manage pain. We do this by giving high-dose analgesics for severe pain, things like opioids, such as morphine. So if the NCLEX gives you a client who has severe 10 out of 10 pain, even though you gave them pain medication an hour ago, does that mean that they're seeking drugs? No, because these clients are often in severe ischemic pain, they require higher doses than normal. These clients can often be falsely accused of being drug addicts because they require so much pain medication. So if their pain is unrelieved, we need to notify that healthcare provider. They might need around-the-clock dosing or higher doses of pain medication. So these clients also need to avoid meperidine because that can increase seizure risk in sickle cell clients. So we also need to use non-pharmacological techniques such as applying warm compresses. Warm compresses vasodilate and increase perfusion, which decreases ischemic pain. We don't use cold compresses because that can cause vasoconstriction and increase that ischemic pain.